you really need to stand up, be aware of it, and prepare yourself for the change to come.
So the stakes have really been elevated.
And that's a significant pressure.
Health law disruption continues to evolve rapidly. It also presents new opportunities and challenges. Navigating this requires collaboration across a range of diverse backgrounds and experiences, something King Spalding have its focus firmly set upon. Staying on top of the rapidly changing health law landscape takes perspective and vision.
There's a saying that all healthcare is local, but increasingly the practice of health law becomes less and less local. What I've observed is a nationalization.
The nationalization and broadening of health law is increasing the need for specialization.
What is happening is that as specialization becomes deeper, there are a smaller number of people in the country who are deeply specialized on a particular issue. And that is the wave of the future. I think the field of health law will become increasingly a national pool.
Excellence in health law today requires a diverse and highly specialized team represented across multiple areas of the legal profession, teams that can react quickly and efficiently.
And that often includes partnering with consultants and data analysts and statisticians and other health law professionals.
It's needed support for healthcare industry leaders navigating complex challenges.
We are in a heightened state of compliance program expectations, sometimes referred to as Compliance 2.0.
Regulators are insisting healthcare organizations implement effective compliance programs that go beyond merely a paper program.
We've really seen a change, and the government can be focused now not only on the alleged misconduct, but also the organization's general approach to compliance.
We look at this as a partnership with our clients to be able to drive, to push the needle forward here on diversity and inclusion issues. And we're finding more and more companies these days are asking very granular questions about not just the team that will be working for this particular company, but they want to know more broadly about the diversity within the law firm.
Watching over ever-changing federal and state policies is a robust Washington, D.C. based team, proactive in its approach for healthcare clients.
The pressure that these companies feel and the regulatory environment in which they operate is incredibly challenging.
Increased public scrutiny on the price of drugs, pressuring more and often confusing state regulations.
If anyone's going to regulate it, if it needs to be regulated at all, it should be the federal government, particularly when we're talking about certain aspects of healthcare and regulating the pharmaceutical and medical device industry in particular.
Subspecialty expertise at work for the client, and innovation driven by disruption in the health law field.
There are so many rules, so much guidance out there, so many ways in which a healthcare provider could stumble.
To keep up with the changes, it takes teams from a range of backgrounds communicating and collaborating in order to see down the road and around corners.
And you can start to detect patterns and bring that information to your client and hopefully not just prepare them, but enable them to be able to affect change on a going forward basis.
And so there's constant collaboration.
Lisa Dwyer's area of expertise is food and drug law, which overlaps into technology and taking digital health products through FDA authorization. New digital products she describes as game changers.
Those products are indeed game changers, yes. Not only in terms of developing new therapies and better diagnostics, but really again in terms of providing greater patient access at lower costs.
And with the dramatic increase in provider consolidation, antitrust practice is getting a lot of action.
First of all, what are the agencies thinking? What are we facing in terms of enforcement? Is it aggressive enforcement? Is it not aggressive enforcement? Kind of what are we facing?
Important questions as healthcare organizations and health law professionals solve problems and provide better care.
We've been seeing in the past couple of years a significant amount of consolidation in the healthcare space, and what comes with that is increased enforcement from federal and state regulators. But we work very closely and very well together, and we've been doing it for a long period of time, and so clients know when they have issues, they come to us for whatever healthcare issues they have.
Finding future solutions for healthcare providers is going to require many things: proactive counsel and a range of consultants who can see around corners quickly, efficiently, and bring a 360-degree view to providing solutions.